I have another question. This one's from Heather, and this also fits into the next question I was planning to ask, which is, how do you treat this? And Heather asks, how do you reverse NAFLD?
Okay. So treatment, reversal, unfortunately, there is no treatment. And that's where I guess our research center comes in. NAFLD itself is relatively benign. It's early part of the spectrum, right? You'd want to halt it or prevent it from progression. So if you have a known risk factor like diabetes or obesity, then try to get your diabetes under control, try to lose some weight, and hopefully it'll halt it or reverse it. But if you have advanced liver disease, it's tough to reverse this condition by just diet and managing your sugar. This has superseded every other condition as the cause of liver transplant today. So it used to be hepatitis C was the cause of liver transplant, hepatitis B and all, but because of the increased incidence of NASH and cirrhosis from NASH and advanced cirrhosis, because of increased incidence of diabetes and obesity, this has become the leading cause of liver transplant in several institutions. And yet there is no treatment. So this is where pharmaceutical companies come in. There is a race to get to find the right treatment. 20 plus pharmaceutical companies in the world, and most of them are doing this research in the US too. Over 20 of them are working on trying to find a treatment. And what that means is they have to go through phase 2 and phase 3 trials. But, honestly, before that, animal experiments, phase 1, phase 2, phase 3 trials. We at Kansas Medical Clinic Research Center, luckily, have 6 of these trials going on. In fact, I believe we are the largest trial location in the Midwest for liver disease, especially fatty liver, NASH, and cirrhosis. So no treatment, but we have good news on the horizon. We still think it may be 2, 3, 4 years before we get approved treatment for this condition.